So how do GLP-1 medications affect the gallbladder? What are the symptoms you should look for if you're on these medications? I'm W.D. Hinojosa. I'm a general surgeon here at Norman Regional Hospital. I focus on minimally invasive surgeries, and I'm going to answer those questions for you. GLP-1 medications like Ozempic, Wegovy, Mounjaro, and Zepbound are fantastic medications and are really changing the management of both diabetes and weight loss. They help control people's appetite while also stabilizing their blood sugars. So people are really seeing a profound effect from these medications. But like with all great tools, you need to also understand the side effects of these medications. And one of those that we're seeing more frequently now is their effect on the gallbladder. When patients are losing weight rapidly, the bile also thickens. So thicker bile means patients develop gallbladder sludge, which then can develop gallstones. They also decrease the motility of the gallbladder, so your gallbladder drains less frequently and slower. Those two things in combination, a slower emptying of the gallbladder in addition to gallstone formation, just leads to more frequent gallbladder attacks. So when people suffer gallbladder attacks, what we're really talking about is usually a sharp stabbing pain underneath the right rib cage. That pain can radiate up into the right shoulder, sometimes to the middle of the back. It can be associated with nausea, bloating, vomiting at times, sometimes some changes in your bowel habits. If you are having biliary colic, which is that frequent discomfort or cramping sensation that occurs occasionally in the right side of the upper abdomen, maybe you should consider being evaluated, holding on your next dose, seeing your primary care doctor, maybe getting some imaging. What we get concerned about is when you also develop fevers. So if you have a sharp stabbing pain in the right side of your upper abdomen and you develop fevers, it's something you need to be evaluated for soon, because you could be developing something called acute cholecystitis, or an infection or inflammation of the gallbladder. Gallbladder symptoms and gallstones don't just magically disappear. In most patients, those symptoms are going to persist and they're oftentimes going to get worse. So when you do develop gallstones and you do start having symptoms from these medications, that's probably when we really need to kind of start considering surgery. The good news is that gallbladder surgery is a relatively quick, easy surgery. It's done minimally invasive, so just a few small incisions. It's usually done outpatient. Most patients can get back to normal life within a few days. The big takeaway is these medications are highly effective. People are getting amazing results from the weight loss. Patients can oftentimes come off of their blood pressure medications, their diabetic medications, or if not come off it, completely reduce their medications. And I get concerned about GLP-1 medications is when patients do develop those symptoms of abdominal pain and fever in particular. If you're on some of these medications like Ozempic or Wegovy, Zepbound, and you are starting to suffer symptoms of right upper quadrant abdominal pain, it's something to reach out to your primary care doctor and be evaluated for, maybe get some imaging and ultrasound performed to make sure that the gallbladder is not the source of those symptoms.